we start with COVID, which has now killed a once unthinkable number in the United States, 1 million people, NBC News data shows. And that is far more deaths than the 1918 Spanish flu epidemic. And also many more than the number of Americans killed in World War II, World War I, and the Civil War combined. That's 1 million American families who've lost parents, sisters, brothers, children, and often the people who earn money to keep the family afloat. I've lost family members to COVID-19. And here's the thing, this didn't have to happen. But from the very beginning of this pandemic, politics overtook science in the United States, and Republican politicians in particular divided Americans over everything from vaccines to masks, all at a time when we needed to desperately come together as a country to save lives. Joining us now is Dr. Arbar Karan, an infectious disease physician at Stanford. So, doctor, how the heck did we get here? What policy failures do you think led us to 1 million Americans dead from COVID-19 in just over 2 years?
Absolutely. This really, I think, took place from the very beginning when the Trump administration started downplaying the virus before we even knew what we were dealing with. I remember being, in the emergency room, taking care of people, entire families who were extremely sick, family members who were dying, others who were too sick to even be with them at the bedside. And at the same time, I was hearing politicians saying this isn't a big deal, this isn't gonna matter, when even infectious disease experts were not sure of that back then. And I think that we got off on the wrong footing. And since then, there have been a lot of missteps taken everywhere from the rollout of vaccines, the rollout of masking, the communications around this. And I think, there continue to be efforts to downplay this, to say, oh, did some of these people die with COVID or not from COVID? I think we're underestimating, frankly, even now in the hospital, we have so many patients who are very sick. And if you look back, it started with a COVID infection. And even though they didn't die, they had so many other complications that happened from it. And people just don't appreciate that. And, it has been a big political misstep as well.
One of the things I think that happened from the very beginning is there was not good simplified explanations as to the purpose of masks and the purpose of vaccines. So I still, to this day, hear people say things like, well, that person tested positive and they were boosted and vaccinated. I don't understand. The vaccine isn't working. And I'm like, the vaccine doesn't prevent you from catching COVID. The vaccine makes sure you don't die from COVID. Can you just briefly, for the folks at home who still do not understand how vaccines work, help them understand why the vaccine is their best chance of surviving COVID, why it's necessary? We're still not at the numbers of vaccination in this country that we need.
Absolutely. So vaccines, the main goal of vaccines is to reduce severe disease and to reduce death. When we started this pandemic, we were having people dying and getting extremely sick. We had hospitals overwhelmed. Vaccines have stopped that from happening. There's still some patients in whom they don't work as well who are immunocompromised, but for the vast majority of people, getting vaccinated, getting boosted, best way to make sure you don't get very, very sick. But there are other things like masks that prevent you from actually getting infected. And masks and ventilation, for instance, work much better. And rapid testing, which can avoid you from unknowingly going and spreading to a lot of people. These are ways to stop spread. Why does it matter? Because the more spread we have, the more variants we have, the better chance we run into a really bad one.
Yeah, and that is that's what keeps me up every night. One of the things I wanted to ask about as well is, I am even anecdotally getting reports from people who attended this weekend's White House Correspondents' Dinner who are either suspicious they may have been in contact with somebody who has tested positive since, or they've tested positive themselves since Saturday night. Large events, they're happening all over. White House Correspondents' Dinner, obviously high profile, but that's not the only large scale event that's happening. People are returning to the office. That's an event with a lot of people. People are traveling on public transit without masks to get to the office. That is a lot of people in one indoor space. Speak to the risk, now that we have no mask mandates, to the fact that large scale events right now are essentially normalized again.
They are normalized, and that does not change the fact that they are still going to be the events that cause super spreading, cause a lot of cases, and we're seeing that play out right in front of us. And I understand the efforts by the Biden administration to reassure people that fewer people are dying, that fewer people are being hospitalized, that vaccines work. That's all true. With that being said, we're seeing new subvariants of Omicron popping up left and right. We're seeing, a big surge of cases in areas of central New York, and we're going to see this at the end of last week, 36% of new cases were from the new BA 2.12.1 variant, and that's going to take over even further. Now, again, just because we want to say that everything's fine does not mean that that's the case. What are we doing for prevention? How are we going to prevent the next big surge and the next big severe variant that could come even this year?
So you mentioned the subvariants of the subvariants. And I have been reading about South Africa. So here in the United States, we've been looking at BA2 and BA 2.12. This is confusing, I know. But in South Africa, they're dealing with BA4 and BA5, subvariants of subvariants. Help us understand why here in the United States, we should be paying attention to this, we should be concerned about this, and perhaps put our masks back on our faces.
So the key thing here is, one, I want to really thank our colleagues from South Africa who, have had excellent genomic surveillance, are able to detect new variants quickly and alert the world that this is something that we need to watch. The two factors to look for are the variants more transmissible, meaning could they cause a huge surge in cases quickly? And that is true. They are outcompeting the previous variants, previous Omicron strains. Two is, are they more virulent? Are they causing more severe disease? That we have not seen yet, and I'm thankful for that. But again, as time passes, right, as people get further from their last vaccination, that situation could change, and it could change pretty quickly. And we're already seeing that actually, if you've been vaccinated, you're more protected from some of these newer subvariants than if you've just had previous Omicron because of the way these mutations are.
Right. Anybody out there who's already had COVID and you're thinking, well, I'm good because I have natural immunity, listen to the doctor. Don't just listen to me. Listen to the doctor. Dr. Abrar Karan, thank you so much for being here, helping us understand all of this as we mark 1 million Americans dead from COVID. Please stay safe. Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.